I'm going to start with the temporomandibular joint diseases. It, it would be a thread which would include a series of videos which will give you an idea of different temporomandibular joint diseases. But before we start with the diseases, I want to brush up your skills with the normal TMJ anatomy and its various features which would be helpful and will make our further steps easier in learning and understanding the different kind of diseases, their pathologies, their diagnosis, and their treatment point of view. So the beginning of this will be with the definition of the temporomandibular joint, okay, which we will say is a gingilomo-arthrodial joint. Okay, it's like this: gingilomo-arthrodial. Okay, which basically means that this joint shows sliding movement and hinge movement both. Okay, this is the reason various, you know, in prosthodontics we can calculate various movements and the orientation, jaw relation, and other features. Okay, now this joint is formed by the articulation of the condyloid process of the mandible. Okay, now this is the condyloid process of the mandible. Let's take some other color, deep green. With glenoid fossa and the articular eminence on the under surface of the temporal squama. Now this is the glenoid fossa. Okay, this is referred to as temporal squama. Okay, this is the glenoid fossa, this fossa. Okay, the temporomandibular joint is located just anterior to the external auditory meatus. Okay, now this is the external auditory meatus, and as you can see, this is our temporomandibular joint, which is, this is our condylar head, this is a glenoid fossa. Okay, and the articular eminence. Now this, through this we understood the basic, bone anatomy, how these bones, the fossas, are in relation to it. Now proceeding with the layers which we, which are in relation with this joint, which includes firstly the skin, followed by the superficial fascia. So firstly it's the skin, then we see the superficial fascia, then a firmly adherent deep fascia, and upper part of the parotid gland are its superficial relations. Okay, these include the superficial relations. of the TMJ. Now, branches of the facial nerve, auriculotemporal nerve, and the superficial temporal artery and vein lie within the portion of the gland. Okay, within the portion of the gland, that is the parotid gland, is facial nerve, auriculotemporal nerve, superficial temporal artery, and vein. Okay, and medial to the neck of the condyloid process within the retromandibular part of the parotid gland are placed the auriculotemporal nerve and internal maxillary artery. Okay, these things were superficial. Okay, within the gland, these were present. Okay, and medial to the neck of the condyle is the retromandibular part, is the auriculotemporal nerve and internal maxillary artery. Now this fossa, glenoid fossa, terminates at the posterior articular lip, which prevents the impingement of the tympanic bone. Okay, this this fossa terminates at the posterior articular lip. Okay, now this is the posterior articular lip, which basically prevents the impingement of the tympanic bone. The fossa continues interiorly, here interiorly, like see, this is, it is continuing interiorly to the articular tubercle, which is now this articular tubercle is convex. Okay, like this, anterior posteriorly, and concave anteromedially. Okay, anterior posteriorly and mediolaterally, it is concave. The condyle of the mandible fits on the articular fossa. Okay, now this fossa, in this condyle fits. It is, now this condyle, okay, is basically oval in shape, convex both anterior posteriorly and mediolaterally. It is a convex shaped structure. Now this condyle is slightly bent interiorly. Okay, you can see from this, it's, it goes like this, slightly it is bent interiorly. This is the anterior and this is the posterior. Okay, it is slightly bent interiorly. The articulating surface of the TMJ is covered by fibrocartilage. Okay, this articulating surface of the TMJ is covered by fibrocartilage. Okay, like this. The meniscus or the articular disc is positioned between the glenoid fossa above and the mandibular condyle below. Okay, now this is the meniscus or articular disc. This purple cushion like thing, it is present between the glenoid fossa, okay, and the condyle. The disc is oval in shape and fibrous and is thinner in the central portion. Okay, from this region it would be thinner and thicker anteriorly and posteriorly in the central part, okay, of the disc. Now this disc is oval in shape and this central part would be thinner as compared to the peripheral region. Okay, it divides the joint into superior and inferior compartments. Okay, now this articular disc is dividing the joint into superior and inferior compartment. Okay, let me give you a clear image if is available. The above will be, let me draw it with some other color. Now between the glenoid fossa and the articular disc, this region, okay, will be the upper compartment, and this will be the lower compartment. Okay, the blue one will be lower compartment and the orange colored will be the upper compartment. Okay, the disc in its anterior posterior direction is concave on the undersurface and concavo-convex on the upper surface. It is attached to the tendon of the lateral pterygoid muscle. Okay, now this tendon is attached, this disc is attached to the tendon of the lateral pterygoid. Now this is the lateral pterygoid muscle. Okay, and it is attached through a tendon to the disc. And thick neurovascular connective tissue called retrodiscal pad posteriorly. Now this joint is surrounded by a connective tissue capsule that extends from the temporal portion of the glenoid fossa above to the condylar neck and below, having attachment with the disc laterally. Okay, the joint cavity is lined by synovial membrane which secretes synovial fluid for the lubrication of joint. Okay, this joint cavity is lined by a layer of synovial membrane. Okay, now this synovial membrane secretes synovial fluid which helps in the lubrication of the joint. Okay, the feature of it is lubrication. Okay, now this capsule of the joint is reinforced by strong temporomandibular ligaments extending from the condylar arch from zygomatic arch to the condylar neck. The accessory ligaments are, sphenomandibular ligament, okay, and the stylomandibular ligament. Okay, sphenomandibular ligament is the accessory ligament and the stylomandibular ligament is the accessory ligament. The sensory supply of the joint is derived from the auriculotemporal nerve. Okay, the sensory supply of this joint is through auriculotemporal nerve, and the vascular network is from superficial temporal artery and external carotid artery. Vascular supply is from superficial temporal artery and external carotid artery. Okay, the temporomandibular joint of the left and right side, although are independent of each other, but are interdependent on the dentition and the function. Okay, a hinge movement takes place in the lower joint cavity and gliding movement of the upper joint cavity. The muscles of mastication produce the movement of the mandible, which are closing, opening, protrusive, retrusive, and side to side movement. The joint components are further influenced by teeth carried in the jaw. Even the size, shape, and position of the teeth in jaws and occlusion influence the joint. The maximum biting load is at the premolar area. Now, as we have some gross idea of this temporomandibular joint, now we have set a basic platform so that we can study in detail the various pathologies of the TMJ, their diagnosis and their treatment point of view. Because if we know a basic idea, I know each and every part of the subject is too vast. There will be a book of on basically the anatomy of the temporal mandibular joint, but our focus for this video was to have some baseline idea of the different relations, structure, nerve supply, blood supply of the temporomandibular joint, and the further required things which will help us in the steps further. We will discuss accordingly, simultaneously with the disease itself. Okay,